Hi, I'm Hope Jensen, and I'm the nurse practitioner here at Manning Regional Healthcare Center. I've been with the facility now for just about 1 year. The face mask recommendations changed this weekend from the CDC. And the reason the recommendations changed is they were concerned about something called asymptomatic spread of coronavirus. And essentially that means that you can have absolutely no symptoms and you could possibly be passing it to other people in the community. And we're not testing for asymptomatic patients right now, although maybe in the future we might, but right now we don't have a good grasp on if that's happening and at what level. So the CDC came down with guidelines to say wear a face mask when you're out in public, and the Iowa Department of Public Health has recommended for people in Iowa to wear those face masks if they are out in situations where it would be difficult to maintain a 6 feet separation from others. So recommendations for when you go to the grocery store, or if you have to go into a pharmacy or any other large box store like that where you might be close in proximity or passing others in less than a 6 foot space. And so that's when we really recommend right now that you would wear a face mask. On our Manning Regional Healthcare Facebook page, we've posted some recommendations for patterns for making face masks, and some require no sewing at all, so that would be in my alley, for no sewing, but you can fashion those face masks and wear them when you're out. Now, some things to remember, of course, you will start to see the healthcare providers and staff at Manning Regional Healthcare Center wearing masks at all times. Please don't be alarmed by this. It's always a little shocking to see people wearing masks. We associate that with having disease. But remember that we're trying to prevent asymptomatic passage of the infection, and that's why we're starting to wear masks. So some things to remember when you have your mask on: do your best not to touch your mask or adjust it. So before you leave the house, do some testing and make sure that it's not moving or falling off your face, because a lot of the idea is we don't want to touch the mask when it's on there. When you get home, you want to make sure you remove the mask and try not to touch the outside. The recommendations are to wash the mask after use, or if it becomes soiled by any ways, or if you feel like your breath has made it very wet, then you want to go ahead and wash that, again, on hot water if you can. Just some recommendations with the mask. Remember, a mask is not a substitute to allow you to go about if you're feeling ill. If you're feeling ill and you need to stay home, it's not okay to be out and about in public just because you have a mask on. So please remember that.